Hello dear students. We already discussed about intercostal nerves. Now we'll have a short discussion on the intercostal vessels. So now we'll see the intercostal arteries. So we know the intercostal arteries are arranged in the intercostal space. The arrangement is vein, artery and nerve. And the upper 9 intercostal spaces, there are totally 11 intercostal space. The upper 9 intercostal spaces contain 3 arteries. Okay, so the arteries are two anterior and 1 posterior. So 2 anterior and 1 posterior. Okay, and what about the last two? The last two spaces are very short. We said that the last two spaces does not have anterior ends because the last two ribs are floating ribs. So because of that, they don't have any anterior arteries, but they have only one single posterior artery. So the upper 9 intercostal spaces consist of 2 anterior intercostal arteries each and 1 posterior intercostal artery each. Whereas the lower 2 intercostal spaces does not have anterior intercostal artery because they have got open anterior ends, but they have 1 posterior intercostal artery. First we'll see about the posterior intercostal artery. So the first and second intercostal spaces. In these regions, the posterior intercostal arteries are branches of the superior intercostal artery. Okay. Whereas in the rest of the region, so altogether we have got 11 posterior intercostal artery. The first two are branches of superior intercostal artery. The superior intercostal artery is a branch of the costocervical trunk, which is a branch of the subclavian artery. Okay. Whereas the last 9, in the lower 9 spaces, the posterior intercostal artery is a direct branch from the forms a direct branch from the descending thoracic aorta. Okay, and these travel in the similar way that of intercostal nerve. They arise from the vertebral end, then they travel through the intercostal space. The arrangement is VAN, that is vein, artery, nerve, and near the angle of the rib it gives collateral branch, and when they reach the costochondral junction, you can see here it is passing like this, the vertebral end. Then here you can see this is the main trunk. Then here they give off a collateral branch, and when they reach the costochondral junction, so this is a sternum, right? So this is a costochondral junction. When they reach this region, the main trunk anastomoses with the upper anterior intercostal artery, and the collateral branch anastomoses with the lower anterior intercostal artery. So we said there are 2 anterior intercostal artery, right? So the upper anterior intercostal artery anastomoses with the main trunk of the posterior intercostal, whereas the lower anterior intercostal artery anastomoses with the collateral branch of the posterior intercostal artery. So what about the anterior intercostal arteries? So we said there are totally only 9 anterior intercostal arteries. So the first in the first 6 spaces, the anterior intercostal arteries, these are the first 6 spaces, the anterior intercostal arteries arise from the internal thoracic artery. So this is the internal thoracic artery, and these anterior intercostal arteries are arising from the internal thoracic artery. There are 2 each. Okay, and from the 7th to 9th spaces, they arise from the musculophrenic artery. Musculophrenic artery is one of the terminal branches of the internal thoracic artery. So in the last 3 spaces, they arise from the musculophrenic artery. Okay, so in case of posterior intercostal artery, the first 2 arise from the superior intercostal artery, which is a branch of the costocervical trunk of the subclavian artery, whereas the last 9, the lower 9, arise directly from the descending thoracic aorta. Whereas in case of anterior intercostal arteries, there are 2 in number, and they arise in the first 6 spaces, they arise from the internal thoracic artery, whereas in the last 3 spaces, they arise from the musculophrenic artery, which is in turn a branch of the internal thoracic artery. And after that, you can see here we have already discussed that the anterior intercostal artery anastomosed with the posterior intercostal artery, the main trunk. The upper anterior intercostal artery anastomosed with the main trunk of posterior intercostal artery, whereas the lower anterior intercostal artery anastomosed with the collateral branch of the posterior intercostal artery. So you can see here, say that there is a free anastomosis between the anterior and posterior intercostal arteries that connect the first part of the subclavian artery with the descending thoracic aorta. So the applied importance of this region is that in case of a condition known as coarctation of aorta, so here there is a narrowing of the arch of aorta. So you know that there is an ascending thoracic aorta, then arch of ascending like this, then arch, then the descending thoracic aorta. From the arch arises the left subclavian, left common carotid, and the brachiocephalic trunk. So the distal to the origin of the left subclavian artery, sometimes the arch of aorta gets narrowed. That condition is coarctation of aorta. So if the arch of aorta is narrowed, what will happen? Blood should be carried to the descending aorta. So since the blood cannot be properly carried to the descending aorta, the blood that will be carried via enlarged and tortuous posterior intercostal arteries. Since posterior intercostal arteries are arising from the descending thoracic aorta. So this posterior intercostal arteries will be enlarged. Okay. So since these are enlarged, that can lead to eroding of the ribs, since they are passing below in the costal groove. So if an enlarged artery is going through this region, there will be eroding of ribs, and that is referred to as rib notching. So rib notching is usually seen in coarctation of aorta. So when there is narrowing of the arch of aorta distal to the origin of the left subclavian artery, the blood is carried to the descending aorta via tortuous or enlarged posterior intercostal arteries. So then only intercostal anastomosis takes place, and this leads to eroding of the erosion of the ribs, that's known as the rib notching. Now we will see what is internal thoracic artery. So internal thoracic artery is also referred to as internal mammary artery, and it supplies the anterior thoracic. You can see the region of the anterior thoracic and also the anterior abdominal walls, and it is a branch of the first part of the subclavian artery in the root of the neck. So you can see here it arises in the root of neck and it descends medially behind the sternal end of the clavicle. So you can imagine the clavicle over here. So behind the sternal on the clavicle, it descends medially, and it descends vertically downwards through the second to sixth costal cartilages. The margin of sternum about 2 cm. Okay, so when it reaches the sixth intercostal space, it divides into the terminal branches, that is a superior epigastric and the musculophrenic artery. So we have discussed about the main branches arising from the internal thoracic region itself, and also the musculophrenic portion. Now this internal thoracic artery is accompanied by some venae committents, and they accompany till the third costal cartilage, and at this level they form a single internal vein which ascends on the medial side and open into brachiocephalic vein. Now what are the other branches? So we said that there are anterior intercostal. You have to definitely remember the anterior intercostal arteries, and also you have to remember the terminal branches, that is a superior epigastric and the musculophrenic artery. And what is the level of the termination? So it terminates in the sixth intercostal space. So don't forget that it terminates in the sixth intercostal space. Now what are the other branches? You can remember it as MPPS, not MBBS. It is MPPS. So M stands for mediastinal branches. So mediastinal branches, it supplies the structures over the mediastinal like thymus, pericardium, lymph nodes, like that. So mediastinal branches. Then pericardiophrenic branches. So these pericardiophrenic arteries, they accompany the phrenic nerve, and they supply the diaphragm. So pericardiophrenic. You can remember phrenic is referred to means diaphragm. Okay, so it passes along with the phrenic nerve and supplies the diaphragm. Next, P is perforating branches, and these perforating branches accompany the anterior cutaneous. So we have learned about anterior cutaneous branches initially, right? So the perforating branches they pass along with the anterior cutaneous branches. In females, the second, third and fourth perforating branches are large for the supply of breast. I think you remember the blood supply of the breast. In that you have learned about this second, third and fourth perforating branches of the internal thoracic artery. The last S is sternal branch. Okay, so there are some sternal branches also that you can see in this figure. So the main branches are anterior intercostal arteries. Okay, then the terminal branches are superior epigastric and musculophrenic artery. Then the rest of the branches are MPPS, that is mediastinal, pericardiophrenic, then perforating branches, and then sternal branches. So what are the main importance of the internal thoracic artery? Internal thoracic artery is more used or favorable for coronary graft in case of any myocardial infarction, that is the layman term, the cardiac arrest or heart attack. Usually the vessel affected is the left coronary artery. There is a branch known as left anterior descending branch of the left coronary artery. Usually that vessel is affected in case of myocardial infarction. So what we do is we select the internal thoracic artery for graft. We have learned about saphenous graft and also here the left internal thoracic artery or left internal mammary artery, it is referred as Lima, L-I-M-A. Lima graft is used. Why? Why is this artery preferred? Because this artery is less prone to develop atherosclerosis because of the presence of elastic tissue in its wall, and also they have got the endothelial cells present in the tunica intima secrete chemicals that prevent the atherosclerosis. Okay, so usually myocardial infarction occurs due to atherosclerosis of that vessel. So if you graft a vessel, definitely that vessel should not undergo atherosclerosis. So because of the two factors, that is the presence of elastic tissue in its walls and the endothelial cells in the tunica intima which secrete some chemicals that prevent atherosclerosis, because of these two factors they are less prone for atherosclerosis, and because of that we use internal thoracic artery for the coronary graft. So now we'll see about the intercostal veins. The anterior intercostal veins are simple. That is, the anterior intercostal upper 6 spaces drain into the internal thoracic vein. So this is corresponding to the artery only. Whereas the last, the 7, 8, 9 spaces drain into the musculophrenic vein. Okay. Whereas the posterior intercostal vein is somewhat complicated. You can see here in this diagram. So initially, the posterior intercostal veins reach the vertebral end of the intercostal spaces and receive intervertebral veins from the internal vertebral venous plexus. After they receive the intervertebral veins, you can see here the first posterior intercostal vein. This is the first posterior. It drains into the right brachiocephalic vein. So this is a subclavian. This is internal jugula that forms the right brachiocephalic. This is the left brachiocephalic vein. This together forms the superior vena cava, and this is azygous vein or the arch of azygous vein that is draining into the superior vena cava. This is accessory azygous vein, and this is hemiazygous vein that drains into the azygous vein. So the first posterior intercostal vein drains directly into the right brachiocephalic vein on the right side. Okay. Whereas similarly on the left side it drains into the left brachiocephalic vein. Whereas the second, third and fourth, the posterior intercostal veins, they drain into a vein known as the superior intercostal vein. Okay, they commonly drains into superior intercostal vein that in turn drains into the arch of azygous vein. And that is on the right side. On the left side also you can see the veins of the second, third and sometimes fourth one also drains into superior intercostal vein or the left superior intercostal vein that drains into left brachiocephalic vein. And the rest of the veins on the right side, that is the veins of the 5th onwards, okay, 5th to 11th one, they drain into the azygous vein. Whereas on the left side, the 5, 6, 7, 8 drains into the accessory azygous vein, whereas the rest of them drains into the hemiazygous vein. So it is a bit confusing. So if you try to learn this diagram, it will be more easier for you. Okay, so lymph nodes. So there are internal mammary lymph nodes. These are also known as parasternal lymph nodes. We have learned internal mammary lymph nodes in the breast. So these travel along the internal thoracic artery and they receive lymphatics from the anterior part of the intercostal space, which that includes the superficial and deep lymphatics of the breast. And also there are some posterior intercostal lymph nodes. And these lymph nodes are located in the posterior part of the intercostal space. That means it is located near to the head of the ribs, and they receive lymphatics from the posterior part of the intercostal spaces. Hope you got a clear idea about the intercostal vessels and the applied aspects related to these and the intercostal lymph nodes. Thank you.